Welcome back, Titans. We are briefly going over H's and T's. We consider H's and T's when we are working a cardiac arrest patient. We want to identify some reversible causes or things that may be hindering your resuscitative efforts. So we use a list of H's and T's. We're going to talk about the causes, clues, and the treatment for each of them. So starting off with our H, we're thinking about hypovolemia, a state in which there is low extracellular volume in the body. This can be from major blood loss in or out of the body, dehydration from diarrhea, vomiting, or sweating, or even a fluid shift during our burns. We are going to provide fluid management for this patient and give them that fluid back via IV, IO. Hypoxemia is a decrease in arterial oxygen level. This can be from airway compromise and respiratory distress. You're going to see cyanosis or poor oxygen saturation or any of those things. Treatment is we're going to want to provide 100% oxygen for this patient and maybe do an advanced airway. Next up is H for hypothermia. Hypothermia is a condition in which the core temperature of our patient drops below 95 degrees Fahrenheit or 35 degrees Celsius. Clue for this would be that the patient was out in the weather and is excessively cold, or even the water. We want to follow our hypothermia algorithms to better manage this patient for our treatment. Hypo and hyperkalemia, we know that is either a low or high potassium level in the body. Hypokalemia could be from diuretics, kidney disease, even diabetic ketoacidosis, and excessive alcohol use. An increase in the potassium in the body could be from medications, kidney disease still, or maybe they're taking potassium supplements. So how we would find this is usually you're going to either have a history on this patient, or maybe you're going to see EKG changes pre or post cardiac arrest. Next up is going to be hydrogen ions. So this is also known as acidosis. Basically, acidosis is an accumulation of acids in the body. So we know our blood pH is usually 7.35 to 7.45. So anytime it drops less than 7.35, and we're talking about metabolic acidosis, there's an acidotic state, and we want to consider sodium bicarb, which is a buffer, to get them back in that normal range. First T is going to be tension pneumo. Tension pneumo is when air accumulates in the pleural space under pressure. What this does is it compresses the lungs, one or both, and it diminishes our venous return back to our heart. This can be from aggressive mechanical ventilation, resuscitation, or even trauma. So for our tension pneumo, you may have absent lung sounds on one side. We may need to do a thoracic decompression with a needle in the chest to help relieve that air pressure. The next T we're considering for our reversible causes is going to be cardiac tamponade. So cardiac tamponade, the definition, is a collection of abnormal fluids filling the pericardial sac, causing the heart not to fill properly. This can be from pericarditis, myocardial diseases, surgery post-op, or even trauma. The treatment modality for this is going to be pericardiocentesis, where a needle is placed into the pericardium and it relieves some of that fluid so the heart can pump appropriately. The next T up is toxins or overdose. So that's a condition that occurs when a drug, either licit or illicit, is taken in excess and can have a toxic or lethal consequence. If it's an opiate in nature, maybe we're considering Narcan for our patient. The last two T's are cardiac thrombosis and pulmonary thrombosis. Cardiac thrombosis being a massive MI, or a pulmonary thrombosis being a clot going into the lungs. We're going to have to get these patients to the hospital, so maybe they're either going to go to the cath lab, and the physicians are going to figure out how to remove or bypass those clots. So those are our H's and T's. A common H that people use in different systems that's not on our official list from our Nancy Caroline book is H for hypo and hyperglycemia. If your protocol indicates anytime we have an altered level of consciousness patient or a cardiac arrest, it'd probably be wise to take your patient's blood sugar to see if we can't fix that as well. So hope this helps. Remember your H's and T's during cardiac arrest, and I'll see you on the next one.